Whether your C-section is planned or not, the length of recovery is still the same. Undergoing a major surgery and healing your body is a major feat for everyone. But the plus is, you have the joyful moment of delivering a beautiful baby that you'll be responsible for as soon as you come out of the surgical area. In many ways, this is a challenging task. I hear you, C-section moms. This one's for you. Hello, moms and dads and parents-to-be. Welcome to Mother Baby Central, your resource for great and practical information regarding pregnancy, postpartum, newborn care, and baby's first year of life. I believe the first step to a fast recovery to anything is having the right expectations and being aware of the events following the procedure. If you have the right mindset into going to a major surgery, then I feel like the rest will not be as rocky as what it should be. Unfortunately, not all C-sections are planned. Some have to be done in an emergency situation. And in these cases, the recovery might be a little different, but not as much. I said different because your mind and body are not prepared for the stress it's going to go through, and you know how powerful our mind can be. If you put in your brain that it will be a smooth recovery, then most likely it will happen. If this is the first time you are having a planned C-section, here's what usually happens. You will be asked to not have anything to eat, including water, at least 4 to 6 hours before the procedure. It will help if you shower the morning of, and don't worry about shaving. The labor and delivery nurse will take care of that. Once you arrive and admitted to the unit, the nurse will begin the process of preparing you for the surgery, making sure consents are signed, giving you the pre-operative medicine, hook you on the fetal monitor, and all of that stuff. Then the anesthesiologist will also come and talk to you and explain the process of the anesthesia, ask some pre-op questions, sign the consent forms, etc. I divided the recovery tips into 2 steps, the immediate and later steps. So let's get into it. Tip number 1, try to rest and avoid talking too much immediately after the surgery. I learned this from one of my best nurse buddies at L&D, who will not even have the dad talk to the patient after arriving to the recovery room from the OR. Take the time to close your eyes and take a power nap, at least for the first few minutes. This will do a lot of great things for your body. Of course, if you're ready to hold your baby, this is perfectly fine. Do some skin to skin and probably start nursing immediately if your baby is rooting. After that, then you can take that much needed nap. Tip number 2, be on top of your pain. Keep in mind though that you're not totally pain-free. Remember about having the right expectations. You had a major surgery, so it is uncomfortable. But the pain should not disable you because you want to make sure you can do other things other than lying in the bed. You need to breastfeed or bottle feed your baby, right? Do not wait until the pain is unbearable. Your nurse is going to ask you to give her a number to rate your pain, 0 to 10. 0, no pain, and 10 is it's like being hit by a truck. She will assess the pain scale almost every hour for the first few hours after the surgery. Then the nurse will also ask what number it is where she needs to start giving you additional pain medication. It could be a 5 or a 6. Whatever it is, different people have different tolerance for pain. So if the number is slowly creeping up to whatever number you gave her, she will intervene right away. In that way, you will be comfortable. Tip number 3, move your body as soon as you can. Again, all patients are different. Some are more sensitive to surgical pain, and those are the ones who will probably barely move from the bed. Be motivated to do the opposite and tell yourself you can do it. Normally, you'll have a urinary catheter, but this has to be removed as soon as possible to prevent infection. So once it is removed, you will be kind of forced anyway to get out of bed to use the restroom. Knowing that will happen sooner than you want, prepare yourself for being up and about at least 6 hours after the surgery. Elevate the head of the bed so you can be sitting upright and you'll be able to turn your body from side to side. Tip number 4, slowly start drinking and eating. Try a liquid diet first. Some ice chips, some warm tea if you don't want anything cold, or sips of warm water. See how you feel. If you don't feel sick to the stomach, then ask for some crackers, then eventually to a regular food. Please avoid greasy foods initially as this might not sit well with you. Try eating light for the first 24 hours after the surgery. Tip number 5, walk as soon as you are able. The first time getting out of bed is very difficult, so take your time doing it. The nurse should be with you because sometimes you might get off balance and dizzy. It won't be good if you fall. Your first destination when you get out of bed is the restroom. The goal is for you to freshen up, wash your face, brush your teeth, put some clean clothes on, brush your hair. You get the idea here. You can walk around the room before heading back to the bed. Stretch your arms and legs. You'll feel like $1 million after doing this self-care. Tip number 6, drink lots of water. Once you tolerate your regular diet, meaning you don't feel nauseous when you swallow anything, hydrate well. Breastfeeding makes you feel thirsty, so before you start nursing, have a big jug of fresh water next to you. One of the reasons why you need to drink a lot too is that if you develop some swelling on your feet after delivery, it will help reduce the edema by pulling the fluid out from your body and excreting it through urination. Tip number 7, pass gas and avoid constipation. How will you do that? Walk, drink lots of water, eat a high-fiber diet, drink some prune juice, take the stool softener the doctor ordered for you. Drink some warm tea. Some patients drink apple juice. They said it helps them to be regular. Or whatever your routine is at home to move your bowels. Eat a high-fiber diet, lots of fruits, vegetables, and whole grains. This is a great segue to the later tips for fast recovery. Eat healthy, nutritious foods. Avoid fast food as much as possible. Your body needs to heal, and so it is best to load up on fruits, vegetables, meat, fish, nuts, and all of the other healthy stuff, as long as you do not have any food allergies. Continue taking your prenatal vitamins and iron supplements if needed. If you are loving this video so far, click on the like button and share it with your friends who will get value from the content of the day. Let us move on to the later tips you need to start doing at home. Tip number 8, get as much help as you can. Once you are home, accept help from friends and family members. Your spouse or partner will be your biggest helper, so try to delegate baby care responsibilities as much as you can. With friends and family, they can help with some household chores, like cooking, doing some laundry, some light cleaning, tidying the house, and the other small stuff. If you are breastfeeding, ask your significant other to burp the baby, change the diaper, put the baby back to the crib, put the baby to sleep, anything that doesn't require breastfeeding. Tip number 9, get some fresh air. Don't be cooped inside the house. Go outside, maybe in your front yard or backyard. Get some sun and fresh air. Walk a little in front of your house. Stretch your legs, wave to the neighbor. Mental health is as important as physical health. I would like to say read your favorite book, but this might not be feasible to everyone. I don't know about you, but when I had both my babies, I barely had time to brush my hair. But that's just me. If you have better organizational skills than mine, squeeze in those unrelated baby tasks to your day. Take deep breaths, pray, meditate, even for just a few minutes. Do some stretching or light exercise. Keep your body moving. Nothing strenuous. Remember, 8 weeks is the recovery period, so no heavy lifting or anything like that during the 8-week period. Tip number 10, get as much rest as you can. Sleep when the baby is sleeping. Give yourself some grace. The first week with the baby can be very chaotic. Do not fret about small things. You are doing the best that you can. Take as many naps as you can, and a nice warm shower will do great things. Dads, be supportive of mom during this period. I know that both of you are exhausted, but mom is dealing with hormone fluctuations too, on top of everything else. Be sensitive to her needs. Don't wait until she asks you for something. Prepare her meals and snacks, let her sleep, change the sheets of the bed, massage her feet, give her flowers, buy her favorite snacks, and all the other loving things you can think of. She will definitely appreciate it. Tip number 11, Follow up with your OB doctor as scheduled. This varies. Some doctors want to see you in the office in like 2 weeks, some 4 weeks, some 6 weeks, some 8 weeks. Make sure you put the information in your calendar so you'll not forget. Call and ask to be seen sooner if you are unwell. Trust your instincts. If you are not feeling right, something is off, schedule to see the doctor as soon as you can. Watch out for symptoms like heavy vaginal bleeding, passing large blood clots, dizziness, headache, epigastric pain, swelling, shortness of breath, signs of infection on the incision site like redness, pain, swelling, foul-smelling discharge, other things like unwavering sadness for 2 weeks, not bonding well with the baby, harmful thoughts towards yourself and the baby, not showing interest in anything at all, poor grooming, and others that you feel is not right. Report these symptoms right away. Alrighty, I think that's all I got for you. Please click on the subscribe button to join our community of parents who want to get the most out of their postpartum experience. I hope you find value in our topic for the day. Be well and happy watching!